Thanks, Jen. Yesterday you seemed to dismiss the idea of sending COVID-19 tests to all Americans, but other countries have taken similar aggressive steps to make testing free available to all citizens. Singapore, for example, sent 6 test kits called Citizens in September. In the UK, any citizen can order a pack of several testing kits all at once. Is the White House's position on this simply a cost analysis, or are there other reasons why the administration doesn't think that sending tests, COVID-19 tests, to all Americans is a good strategy?
Well, let me give you an overarching, comprehensive understanding of how we're approaching this to give you a sense, and I appreciate the question. So our objective is to continue to scale up our testing program to meet demand and ensure that people who want tests are getting tests. And there are a range of ways people want tests. Some people want to do it in their homes, certainly, and we've seen an increase in demand for that in recent months, and we've quadrupled our capacity in that regard. So we'll keep building. Some people want to go to their primary care physician. Some people want to go to a community health center or rural health center. Some people want to have their kids tested at school, an option that many public schools have made available, or in private schools, I guess, as well have made available. So what our focus is on is ensuring that everyone in America has access to free testing, whether at a doctor's office, pharmacy, community testing site, or now at home. And there's a couple steps we've taken from the beginning. We haven't always, there's obviously a lot of interest in testing now for good reason. And one, in February, we wrote new guidance to make insurers cover asymptomatic PCR and point of care tests, critical to helping the majority of Americans who have private insurance not worry about burdensome test costs. So what that means is, before that, if you went to get a PCR test, as we know, which is a test that can certainly track very closely whether you have components of the virus, you had to pay for it. Our private we now insured many months ago that was not the case. As I noted, we quadrupled the number of free pharmacy testing sites with a priority on vulnerable communities in addition to state and local community sites. So today there are 20,000 sites across the country with free quality tests. That means you can walk into the pharmacy, get a free test, get it done, ensure you're taking that step. That's the preference for some. We've also secured funding from the rescue plan, invested it in hardest hit areas, $10 billion for schools to conduct testing, nearly $1 billion for rural clinics and hospitals. And toward the summer, we also planned for the school year, ensuring school districts had the resources to set up a testing program to ensure kids stayed in school. We also doubled down our work to get testing to congregate settings that were more vulnerable and where demand was higher. As Delta hit in the summer and demand increased for testing, we immediately jumped into action. And as we've seen at-home tests become more in demand, we've taken steps on that front to make them free. So if you have private insurance, we're making sure you'll get reimbursed by your insurer for at-home tests, if that's your preference, if that's what you would like to do. And we made sure that the tests you get from your healthcare provider, like PCR tests, are covered with no copays. I also would note that we also announced last week we're sending 50 million free tests starting this month to convenient locations like health centers and community sites. So overarching, our objective here is to make them accessible, to make sure that people who want to get tested can get tested in any means they choose to do, and to make sure they're free for everyone in America.
And I understand all those efforts, but wouldn't it be a good idea to just send them to all American homes? It seems like that would make it more readily available to just, have it sitting, knowing that one is just sitting in your kitchen somewhere. Why isn't that a way that it would be an effective strategy?
Well, our assessment is that the best way to make these tests readily available and accessible to people is to make them available, meet people where they are, and make them available at places where people go: community health centers, rural health centers, pharmacies, doctors' offices, schools, and also have a component where people can have tests for free at their home. But our approach is not to send everyone in the country a test, just to have millions of tests go unused where we know others can make use of them. So we have made an assessment about how to make them free and available to Americans across the country. That's absolutely our objective, and we'll continue to build on it.
And you did seem to reference cost yesterday, so is that concern with just how logistically, financially, how hard that would be to get to all American households?
Again, our objective is to make them readily available to people where they are across the country, and we have made the assessment that doing that is most effective by donating these 50 million tests to community health centers and rural health centers, by making them available at 20,000 pharmacies, by working with schools and workplaces to make testing available, and also to providing the option for people to get free tests in their homes. Go ahead.